There is no provincial indication yet, or no indication yet, of a province-wide closure of schools, as I mentioned. But yesterday you made another significant move, invoking an order under Section 22 of the powers available to you, and closing the schools in the Toronto District School Board, private schools, all of the schools in Toronto. And I'm wondering, in your statement announcing this, you refer to the current circumstances. What changed, Dr. de Villa?
Well, what's changed is really a question of the variants and the impact that they were having. We were seeing more and more community activity. The cases were going up, the rates were going up in the community. And in fact, what we were seeing in our schools was a reflection of exactly that. Increased community COVID-19 transmission was manifesting itself as increased COVID-19 cases in schools. And, with the greater transmissibility associated with these variants of concern and the greater risk that they pose, we were really left with no choice but to make that very, very difficult move. And it was one that, was very difficult for us to make. It seems like an easy choice, but I can assure you that this is a very, very difficult choice to make, given that we know how important in-person learning is.
Well,
but, I had made a commitment all the way through the pandemic that we would watch our circumstances and monitor and do our very, very best to maintain in-person learning, but certainly not at all costs. It's all about health and safety first and foremost.
And yet it is confusing as you talk about the community spread as reflected within greater numbers in schools. The whole question has always been, are schools drivers of COVID transmission? And of course, the province immediately responded to your move saying schools are safe. The Children's Health Coalition said the schools should be closed only as a last resort. So does your move suggest that you have seen data to show us that it is no longer safe in schools?
No, it's not that at all. It was a question of looking at what was happening in the community and seeing that as a reflection of an increased number of cases in schools and recognizing with variants of concern that we do have greater transmissibility. And so it was really a question of making sure that we were providing as safe an environment for kids as is possible, knowing that with all the cases that were coming in, the risk was going up. But to date, I will say that there has been heroic work done on the part of our school boards, our school partners, families, students, and of course, public health staff in partnership with all of them. And they have really done an incredible job at providing good public health measures, good solid infection prevention and control measures within our school setting. And we have done our very best to continue that in-person learning because we know that that's really, really important. And it's my sincere hope that now that more significant measures appear to be in the offing, and that we can bring community transmission down. That's what the hope is from those broader measures. The hope is that if you do that, that we can then see that reflected in school numbers and get our kids back into school as soon as possible in as safe a manner as is possible.
And reopen. As I hear you, though, again, reiterate that schools are safe, I think about what parents are telling us already in light of the announcement that the schools are closing, the parents of the 300,000 children who are going to be affected by this, if they're safe and if in-person learning is so preferential, why this move, and particularly why this move with mere hours of notice? Even Toronto's mayor had asked for 1 day to give parents time to prepare. What was so pressing that you needed to make that announcement so quickly?
Yeah, it was, again, over the course of the weekend, we were getting information in from our schools, reports back from the numbers of tests and outbreaks being declared, and the need to really take a more concerted approach in light of the risk that we were seeing growing. Again, it's all about the community transmission. When we see high levels of community transmission, that reflects itself in our schools. We need measures in our community to really address the spread in the community. That's the optimal way to manage what's happening and to create safe environments within our school. Now that we know that that's happening, I'm hopeful that that will really have significant impact on case counts in the community and therefore case counts within our schools, and will allow for that opportunity to get our children back into in-person learning as soon as possible.